woman's bladder makes its own alcohol. A Pennsylvania woman kept testing positive for alcohol despite not drinking, effectively keeping her off a liver transplant list. Testing positive for alcohol disqualifies patients from receiving new livers, even if they absolutely need one. The diabetic patient, 61 years old, had gone to the University of Pittsburgh Medical Center Presbyterian Hospital to seek treatment for her cirrhosis. Cirrhosis is scarring of the liver due to liver disease such as hepatitis and damage from chronic alcoholism. She said that she had already been to another hospital for treatment, but they told her she must have been addicted to alcohol and could not get a new liver. Doctors of the new hospital also believed she was secretly abusing alcohol until they noticed something puzzling in her test results, linking it to autobrewery syndrome. The study on the woman's condition was published on February 24 in the Annals of Internal Medicine. The patient's urine tested negative for ethylglucuronide and ethyl sulfate, despite testing positive for alcohol. The doctor said that at least one of those two metabolites should test positive days after alcohol consumption. The patient also tested negative for ethanol and did not show symptoms of intoxication. After taking into consideration the patient's uncontrolled diabetes, the doctors hypothesized that the woman's high levels of glucose and yeast had interacted with each other. The yeast had colonized the patient's bladder, fermenting sugar into alcohol. They confirmed the yeast fermentation in an experiment with the woman's fresh urine. The researchers put the urine on ice, incubated it in a test tube at 98.6 Fahrenheit, and saw the production of ethanol firsthand. The doctors were able to identify the yeast in the patient's bladder as Candida glabrata, a common microbiome in humans. This is the first case of its kind, though a few diabetic people have had ethanol detected in their urine in the past. The only difference is that previously documented fermentation occurred only in the test tube or post-mortem. After being diagnosed with autobrewery syndrome, the lady was put back on the liver transplant list. Autobrewery syndrome is a very rare disorder in which microbes in one's gastrointestinal tract turn carbohydrates into alcohol. Someone with this condition could become intoxicated just from eating carbs. The syndrome is also known as drunkenness disease, causing one to look and feel drunk. It could also trigger the development of other conditions like irritable bowel syndrome, chronic fatigue syndrome, and anxiety and depression. No one is safe from autobrewery syndrome, not even children, but it isn't present at birth. Crohn's disease, short bowel syndrome, and liver problems could set off autobrewery syndrome. Doctors normally use stool tests and glucose capsules to diagnose patients with the disease. Changes in diet and the use of antifungal medications have been known to treat autobrewery syndrome. The patient in the newly published study had fermentation occurring in her bladder, and the alcohol produced by her body never entered her bloodstream. The doctors who documented her case have proposed naming her condition bladder fermentation syndrome or urinary autobrewery syndrome.